Overcoming compassion fatigue. When practicing medicine, feel more like labor than labor of love. Take steps to heal the healer. Dr. XYZ had always been energetic and dedicated obstetrician and gynecologist. Now at 54, the gynecologist is tired, lonely, cynical, angry and irritated at the increasing demands put forth by his patients. Although the relationship with the patients once thrived, they no longer seem to give the doctor that satisfaction. Even talking to his spouse, who had always been a supportive partner, has not relieved the doctor's feelings of intense isolation. This is called as compassion fatigue, a deep emotional and spiritual exhaustion accompanied by acute emotional pain, the result being that they tend to indulge more into the profession, finding it difficult to maintain a healthy balance of empathy and objectivity. What are the causes? The disease is flourishing due to the demands of managed care. The doctors see more patients, do more paperwork, negotiate more contracts, and have less autonomy than ever before. Add to this self-imposed pressure to live up to their own high standards, and it's no wonder these doctors feel like they are going up in flames. Time is the enemy. To those who are in the throes of compassion fatigue, time, or more precisely, the lack of it, is the enemy. This leads them to doing several jobs at the same time, multitasking, which leads them to exhaustion irrespective of a good sleep. There is hope. So if one recognizes the burning out phenomena and gets into a habit of doing something which will replenish him, it will help him. It's not as easy as it sounds. Old habits are oddly comfortable. To build new habits, one has to repeat doing it consecutively for 21 days with immense desire and energy. Some of the new habits could include: first, exercise, which should be done regularly. Second, spend time with family and friends whom you haven't seen in recent months. Thirdly, taking morning walks with spouse to reconnect to the world. Fourth, spending time with the elderly parents. Fifth, working on some fantasized projects for which you never had time. Sixth, meditation. What does meditation do? It helps overcoming compassion fatigue by coming to terms with anger, fear, and self-doubt, which we as doctors have suppressed since medical school. This requires honest self-reflection. I am stressing on honest self-reflection. Seventh, finding someone to talk to who is a good listener, understands compassion fatigue, and with whom you feel a connection. This person is usually a professional counselor, but a colleague with first-hand knowledge of compassion fatigue, a spouse or a friend who can listen without judging or offering solutions are other alternatives. What are the warning signs of compassion? Anger, blaming, chronic lateness, depression, diminished sense of personal accomplishment, exhaustion, physical or emotional, frequent headaches, gastrointestinal complaints, high self-expectations, hopelessness, hypertension, inability to maintain balance of empathy and objectivity, increased irritability, less ability to feel joy, low self-esteem, sleep disturbances, and workaholism. Develop your own self-care plan. The lifestyle change you choose to make will depend on your own unique circumstances, but 3 things can speed your recovery. First, spend plenty of quiet time alone. Learn mindful meditation to stop thoughts to pull you in all directions. Recharge your batteries daily, sometimes as simple as to eat better and stopping all activities, having full concentration on your food while eating can have an exponential benefit on both your psyche and your physical body. A regular exercise regimen can reduce stress and help you achieve outer balance and re-energize you for time with family and friends. Thirdly, hold one focused, connected and meaningful conversation each day. Time with family, friends, feed the soul like nothing. And sadly, the first thing to go with shortage of time. To sum up, what are the do's? Find someone to talk to. Understand that pain feeling is normal. Start exercising and eating properly. Get enough sleep. Take time off. Develop interests outside your subject. Identify what's up to you, what is important to you. Words of advice. Compassion fatigue can impair your functioning in ways that you need to keep in mind. So, what are the don'ts? Don't blame others. Blaming administrator, staff, colleague or the system will do you no good. This will exhaust you even further and prevent the deeper healing that needs to take place. Don't go out looking for a new job till you have forgotten your stress or got over your stress. Don't make big decisions until you have recovered physically, emotionally, spiritually. Don't quit your job. Don't get a divorce. Don't have an affair or spend your money on lavish trips or a new sports car. It may feel great at that time, but a few weeks or days later, you'll find yourself waking up to the same set of problems. Don't spend your energy complaining. Avoid commiserating with discontented colleagues. As you must have heard, misery loves company. It is easy to fall into habit of complaining when you are consumed by compassion fatigue, but it will only make you feel worse. There are more constructive environments to share your feelings. Don't try a quick fix. Compassion fatigue may make you vulnerable to addictive behaviors and substance abuse. Some will work harder and longer. Others self-medicate with alcohol, prescription drugs or sex. These quick fix attitudes always end up complicating an already overburdened life, escalating the downward spiral. A healthier future. One may think it's easier to take care of oneself without the daily stress of work. But what happens when one gets back to work? To maintain this rhythm of do's, one has to develop one's own principles of practice, a type of personal mission statement, articulating one's own values and parameters to which one is comfortable with. To create this, one should be able to answer what gives my life joy and meaning. Commit to these developed principles and use them to guide you in your decision. And learn to say no without guilt to requests that do not align with your vision. After planning out this healthy routine or work pattern for yourself, get back to work, physically and emotionally fit. Maintaining your appointments of exercise, meditation, and time for family, giving in equally to profession and to a healthy routine. There are many visible stories which are tip of this iceberg of this problem, which has grown many folds in the past years. The age group which is attacked by this syndrome is 45 to 55 years. So grasp this statement: you can be an obstetrician and gynecologist without having to compromise your well-being. But living a balanced life does require that you take time for self-reflection, identify what's most important to you, and adopt healthier lifestyles. This is not what's taught in all medical schools, and it's not something which can wait till changes occur in the healthcare systems. So help to identify what's important to you. It can help you feel better about your life and your life's work. Thank you.